Hi Roberta, I'm Christina. I'm going to be finishing your exam today. I'm going to start off with the cardiac system. Any problems with your chest, palpitations, any pain in your chest at all?
No.
Okay. I'm going to inspect the carotids for any jugular vein distension, and then I'm going to auscultate the carotids for any bruits. I'm going to come down to the heart. I'm going to check your apical heart rate. So we're getting a heart rate of 70, which is normal. Now I'm going to check for any heart murmurs. I'm going to listen again with the bell for any heart murmurs. I want you to go ahead and turn over on your left side for me. I'm going to listen at the apex of the heart. Okay, none of her. Go ahead and lay on your back. I'm going to palpate the chest for any masses, any abnormalities. Then I'm going to go ahead and have you sit up beside the bed there. You want to sit up?
On this side.
Yeah, that's fine. We're going to go right into the respiratory. So I'm going to inspect the back. I'm going to inspect her shoulders for symmetry. I'm going to go ahead and take some deep breaths for me. I'm going to look at inhalation and exhalation for any difficulties there with that. I want you to go ahead and check for tactile fremitus. I want you to say 99 for me.
99.
Again.
99.
Again.
99.
Again.
99.
Okay. Now I'm going to go ahead and percuss. Listening for any dullness that could indicate a mass or consolidation of the lungs. Which is good. Now I'm going to auscultate the lungs bilaterally. Go ahead and take some deep breaths in for me. Always go back and forth because you want to compare the lung fields. Go ahead, take some deep breaths. Go ahead and breathe normal. Now I'm going to check the costovertebral area for any pain. Any pain with that?
No.
And any pain with that?
No.
Okay. So go ahead and lean forward. I'm just going to check your spine. Check the vertebrae of the spine. Any pain with that?
No.
So now I'm going to come around and I'm going to check the anterior chest. Go ahead and take some deep breaths. Again, I'm checking the shoulders for symmetry. I'm looking for any distress with breathing. Now I'm going to check for any masses. Okay. Now I'm going to percuss the upper fields. I'm going to auscultate. Take some deep breaths for me. go ahead and lay back. I want you to go ahead and say that 99 for me again. I'm going to check for tactile fremitus. Go ahead and say 99.
99, 99, 99.
Okay. Now we're going to go straight into the abdominal. Any pain that you've noticed in your abdomen, any tenderness,
No.
distension, any problems like that? Okay. So I'm going to go ahead and listen to the abdomen. Always listen before you palpate due to possibility of having an acute abdomen. Good bowel sounds are noted. I'm going to listen above the aorta for any bruise there. I'm going to listen over the renal arteries for possibly any bruise there. I'm going to listen at the iliac. And also at the femoral area. Okay. I'm going to lightly palpate any pain.
No,
Any pain?
no,
Now comes deep palpation. Any pain?
no,
Any pain?
no, 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 no.
We can palpate the liver by having the patient take a deep breath. Usually it's not only the tip is palpable. Go ahead and take a deep breath in. Okay. Deep breath. Go ahead and palpate for the kidney by doing the Duckbill maneuver. Go ahead and take a deep breath in. Hold it. Okay. And then you can usually only palpate the spleen if it's enlarged. Usually start over by the abdomen and move your way over. Any pain?
No,
So I'm going to go ahead and go down and feel for femoral pulse. I'm going to go back up and I'm going to check bilateral brachial pulses. And check bilateral radial pulses. Just to femoral. So go ahead and bend your leg up. I'm going to check your popliteal pulse here. And bend this one up. And I'm going to check with your tibial and dorsalis pedis. And they're pretty good. Okay. Going to inspect the skin of the legs while we're here. I'm going to check warmth. And we're going to also check for edema. And check edema of the feet. And also she does, checking her toenails, she does have some onychomycosis, a fungus infection to her great toes and her second digits. There. I'm going to go ahead and lay it flat. While you're here, I'm going to go ahead and check for, go ahead and bring your right leg up, straight up. We're going to check your hip, straight up and back down. Okay, I want you to bring your leg to the inside, like this way. Yep. And the same this way. Okay. Go ahead and sit up at the side of the bed. I'm going to check your knees. I want you to go ahead and we're going to inspect and then palpate for any masses, any fluid. Go ahead and push my hand forward. Okay. And don't let me, go ahead and put your leg straight. Don't let me push your leg forward. Hold it back for me. Okay. Now I want you to move your ankle. Can you move your ankle around for me there? Okay. I want you to bring your toes up towards your leg. I want you to go ahead and point your toes to the ground. Turn your ankle towards the inside and turn the ankle towards the outside. And we're going to do the same thing for the other. I'm going to inspect the knee, palpate for any fluid. Go ahead and try to push my hand forward. Okay. Don't let me push your leg forward. I'm going to move your ankle all around. Touch your toes up, bring your toes up, push your toes down, bring your ankle to the inside and to the outside. Okay, now we're going to get down to the foot. Don't let me push your foot up. Don't let me push your foot down. Same for this one. Good. I'm going to check your reflexes. So now we'll do your upper first. So bring your arms straight up to your head. Yep. Hold them straight up. Can you hold both arms straight up? Good. Now bring them around to the back of your head. Okay, straight back up again. Now bring them down around your lower back. Good. Okay. Go ahead and sit straight. I want you to take your chin, touch your chin to your chest. Put your head back as far as you can. I want you to touch your chin to your right shoulder.
Hey, the first one's coming up.
Touch your chin to the left shoulder.